Good evening, everyone. My name's Rob Hatton. I'm the communications manager with Grey County. I'm going to be helping to moderate our call tonight. On the line with us this evening is Jennifer Cornell. She is the Director of Long-Term Care for Grey County's 3 homes. Tonight, our call is going to be similar to the other 2 that we've had in the past. So it will be familiar for those of you who were parts of those previous calls. But if you are joining us for the first time, I will just quickly give you a rundown of our format. So we're going to start tonight with an update from Jennifer. She's going to let you know what's going on in the homes and some of the changes that we've adapted to over the past couple of weeks since we last spoke. And following that, we're going to open the floor up to a full Q&A session. And if you do have any questions that you would like to ask tonight, I would ask those of you joining us online through your computer or through the phone app to enter your questions in the chat feature. You should see a little chat bubble on the bottom of your screen. You can click on that and enter your question, and we will get to those when we get to the Q&A portion of our call. Unfortunately, for those of you on the phone line, we aren't able to take your calls live tonight. But what you can do is if you do have questions that we don't answer through Jen's update or through the Q&A session, you can always email those to communications@grey.ca, and we will get back to you with those answers. So with that, I will pass it over to you, Jennifer.
Great, thanks, Rob. Good evening, everyone. Thanks for being here. I have some notes that I'm just going to pull up and go through to give you an update. So I'll start with just a reminder that this presentation is intended for the family and loved ones of the residents of Grey County Long-Term Care Homes. We encourage you to share this with others in your community. For those viewing this who have family or loved ones in other long-term care homes, please understand that this information is only related to Grey County's homes. Please contact the home where your family member or loved one lives if you have any questions or concerns about their care. So, good evening. Thank you very much for joining us tonight. As Rob said, I'm Jennifer Cornell, and I'm the Director of Long-Term Care for Grey County's 3 homes, Lee Manor in Owen Sound, Rockwood Terrace in Durham, and Grey Gables in Markdale. We last met virtually on April 9th, 2020. Since that time, there have been further directives from the province, the Ministry of Long-Term Care, and Public Health, as well as many strategies implemented within the homes. As of today, there are still no positive cases of COVID-19 in any of the 3 homes. The purpose of our call tonight is to provide an update and to reassure you that we are doing everything we can to keep your loved ones safe while continuing to color it for them every day. During this call, we will provide updates on crisis planning regionally and locally, swabbing plans, transfers between long-term care and hospital, changes to the essential visitor protocol, as well as including window visits, care packages and Mother's Day plans, staff wellness, and answer any questions that you may have. So that sounds like a long list, so I'm going to get going. We've been actively working on all things COVID for many weeks, and we are committed to staying the course. A leader that I admire shared a quote about the miserable middle of change, and I believe we are in the difficult middle of this journey through COVID-19. In the beginning, adrenaline keeps us going, and at the end, we can see the light dawning of a new day. But in the middle, we must keep our courage and our faith in the process. So we're in the middle, and the middle can be a hard place to be, but we're committed to staying the course. So I'm going to just give you an update on the strategies that we have in place. So staff are working only in one facility. We are minimizing the movement of staff from home area to home area within the home. All staff in the home are wearing surgical masks at all times. All new residents moving in from the community are tested for COVID-19 before they move in, and they're isolated for 14 days within the home. Hospital admissions are paused for right now. The leadership teams in the homes have divided into 2 teams and will be working in the homes to provide support and leadership 7 days a week. Plans are in place in all 3 homes to quickly isolate residents if needed, and plans are in place in each home to quickly move into full outbreak protocol if needed. The province and the region has been actively working to develop supports for long-term care homes if they find themselves in a crisis. A crisis response and stabilization plan has been developed. So if any long-term care home or retirement home in Grey Bruce needs critical support, there is a plan. The crisis response focuses on supply of PPE, infection control support, and human resources support, so staffing. The risk levels are monitored and tracked daily. Risk levels are identified as green, yellow, or red. Red is critical. All of our homes are currently in the green risk category, and we are monitoring that every day, and we're monitoring it closely. Swabbing. There's been a lot of media coverage regarding expanded swabbing in long-term care. At least 5 homes in Grey Bruce have already had all staff and all residents tested. Public Health is working on a schedule for the rest of the homes. There are 19 long-term care homes in Grey Bruce. We are currently preparing for the possibility of our testing in our 3 homes to happen the week of May 11. Transfers between long-term care and hospital. All admissions of residents from hospital have been put on hold. We are only having people move in from the community at this time, and they're tested prior to admission, and then they're isolated for 14 days. A new directive was released this week that clarified residents who are admitted to hospital for a reason that is not COVID related, and they are ready to return to the home, they can come back as long as the home is not an outbreak and can isolate the resident for 14 days. They also require a negative swab result before they come home. I made a commitment on our last call to reevaluate the visitor restrictions that are in place every week. So while we continue to focus on keeping the virus out of the home, we work closely with public health and our clinical teams on evaluating the risk of various activities. We have adapted the protocols to take into consideration when a home is not an outbreak versus a home that is an outbreak. We're still under strict directive to restrict all visitors into the home except essential visitors. We have revised the protocols around essential visitors. So I'll just go over again. An essential visitor is permitted into the home with strict guidelines. An essential visitor is a person permitted to visit a very ill or dying resident. The nursing staff and the physicians will assist with the decision of when an essential visitor can come into the home. Here's where the change is. If the home is not an outbreak, there is no limit to the number of essential visitors a resident may have. So for example, if a resident has a family with 3 children, for example, each child can take a turn at being an essential visitor. The rule still applies that there is only 1 visitor at a time. They must be screened and wear appropriate PPE. However, if the home is in COVID outbreak, each resident will have 1 designated essential visitor, and all other visits will remain committed. We remain committed to assisting with virtual visits through the Color It Connect program. And if there's questions about that, we can revisit this at the end in the Q&A. Regarding window visits, in consultation with public health and our clinical teams, we've developed an approach that we are hopeful will support the goal of maintaining safe infection control practice and also support the overall well-being of our residents. Our concern about window visits continues to be minimizing the movement of residents and staff throughout the building and supporting our current staffing resources. To that end, we're working on a system of pre-scheduling window visits. This will ensure that staff are available to assist the resident with accessing the window, assisting with the telephone if that's being used as part of the visit, and then ensuring that the resident returns safely to their home area. We can also be sure that the designated space is cleaned properly between each resident. Scheduled visits will also be used to ensure we're managing the potentially large influx of visitors that would attend the grounds of the homes. If your loved one's room has a window in their room that allows you to see each other without support from staff, we will not be restricting those visits, and those do not require an appointment. We would remind everyone to maintain the safe physical distancing practices. If, however, your loved one needs support for a window visit, please let the home know that you would like to set up an appointment. We have made this change only today, effective today, and so we will do our best to accommodate as many requests as we can while we work out and communicate the system. So over the weekend, there may be an influx of requests made, and we are going to do our best to accommodate as many as we can. Early in the week next week, we will be able to communicate how to make an appointment and what that system looks like. I would like to remind everyone that there are 322 residents across the 3 homes, so please have patience with us. Mother's Day is coming up, so a few words about Mother's Day and care packages. Mother's Day is fast approaching, so I'd like to go over this process. We continue with the process of holding items prior to delivering them to residents. Based on public health, we're now holding items for 24 hours rather than 48 hours. We will circulate the public health document that has a lot of suggestions that are helpful for all of us within the home and within your own home on handling mail and packages. So we'll circulate that. A reminder to please not drop off perishables or baking. For Mother's Day weekend, there are lots of physical distancing approved activities planned from the staff in the home. Everything from manicures and pedicures to flowers and treats to hallway tea parties, with lots of scheduled Color at Connect visits in between. Staff wellness. I've had a lot of people checking in to make sure that the teams are doing okay. Our staff in the homes continue to be amazing, strong, and positive advocates for the care and safety of all of the residents and each other. We continue to train staff from other departments in the county to be ready to assist if the time comes. Some redeployed staff are actively working in the homes, helping with the Color at Connect program, and we anticipate they will also be able to support the scheduling program for the window visits. We are all feeling the effects of the changes right now, but overall there continues to be a positive vibe and a whole lot of teamwork. The support they're getting from you and the community is amazing. They wanted me to be sure to pass on their gratitude and appreciation for all of the gestures, small and large, just to show just how much they're loved. So thank you for that. That's a lot of information. I thank you for your patience, and let's go to questions.
All right, thanks, Jen. So we have one sitting in here right now, and you may have addressed it, but that's okay. We can just reemphasize here. In the meantime, if you have any questions, please do enter them into the Q&A along the bottom or the chat. I will try to keep an eye on both. But the question here is, so you talked about window visits, but is there any projection of when we can get back in to see our elders?
So we don't have a time frame for this. There is lots of work actively happening locally, regionally, and provincially to come up with a plan of what that looks like. And our goal is to have a phased-in approach so that we can share with you what the plan is and what that might look like. And I was shared a document from Alberta, and Alberta is in a little bit of a different stage and phase than we are. And they have a very good document that outlines phased in approach for introducing visits and what that might look like, including how to safely do an outdoor visit with 3 people. So we're getting those resources from wherever we can, and we're working on building something. As soon as we have something that we can share, I will do that.
That's good. We have a question here. Are staff planning to get residents outside on nice days, and how would we accomplish this?
Yes, so the teams in the home are committed to keeping life as normal as possible given the circumstances. And so there is still exercise programs happening, not in groups, but in individual. When the weather is nice, residents are going outside, there's courtyard space. We're careful to make sure that we're following the physical distancing. And that's I'm glad that you brought that up, because it allows me to just remind everyone that when you are coming to a window visit, there might be residents outside having a cigarette or enjoying the sun. And as hard as it is to not get close to them and say hello from a distance.
Thank you. Pamela just is asking in the chat to clarify, yes, Pamela, this update tonight is just for Grey County's 3 long-term care homes. So that's Lee Manor in Owen Sound, Rockwood Terrace in Durham, and Grey Gables in Markdale. Next question here. Are residents still getting exercise, Jen?
Yes, so there is still physio programming going on and exercise programs, not in groups and more individually, one-on-one.
Thank you. Would you be able to repeat the essential visitors and how they could possibly visit our loved one?
Sure. So I'm just going to pull my notes back up here. Okay. So essential visitors is a person permitted to visit a very ill or dying resident. That's a definition that comes from the province. And the nursing staff and physicians will assist with the decision of when an essential visitor can come. So the staff will be in communication with you and talk about your loved one's health and care, and that they may fit that criteria of being in need of an essential visitor. And then I'll just clarify that we had been restricting the essential visitor to 1 designated visitor, and that has been relaxed in the situation where the home is not an outbreak. It's still 1 visitor at a time, but a resident can have as many essential visitors as necessary. So if there are 3 or 4 of you in the family that should and would come to see that person, you can do that, just at different times.
Thank you. So you mentioned that items are being held for 24 hours now. Are we doing any disinfecting of materials that come in?
Yes, so that's a great question. We're wiping everything down and with disinfectant wipes, and then we're leaving them in a, if there's packaging that is not integral to the package, then we're disposing of the packaging, doing good hand hygiene ourselves, and then holding it for the 24 hours. So what's nice is that if it's flowers, for example, it's not 2 days before your loved one is going to get flowers, it's 24 hours.
Great. Is the resident doctor visiting in person in the homes, or is it being done virtually?
So that is a really good question, and I think it might be different at each of the homes. There are physicians coming in on site to the homes. When they do come in, they are also screened and are wearing appropriate PPE. So if they are working in a hospital where they may have been in contact wearing PPE with someone with COVID, then when they come into the home, they're not wearing just the mask, they're wearing the full PPE.
Okay. Can some of the Color It Connect or activity staff members be assigned to water a resident's plants? Is this a service that they can sign up for on behalf of their resident?
That is a great idea. So I will take that back to the teams and we'll figure out a solution. Thank you for bringing that forward.
All right. Here's a question going back to the last call and foot care. Did we find out if the foot care or for diabetic residents is still happening, and is there a timeline for finding out if we haven't yet?
Okay, so we did find out, and I thought about putting that in the update, and then I forgot. So thank you for bringing that forward. So yes, the teams in all 3 homes have confirmed that they have a plan in place for foot care. So they either have registered staff on staff who are foot care providers, or they have registered staff on staff who are trained in providing foot care, and that's not something that they do somewhere else. So foot care is being handled in-house. We have ordered and received some of the foot care kits that are required, and that's happening. If you have a specific concern about your person, reach out to the home and just touch base with them. but there are plans in place.
Great. That is all I see in the questions so far. So if you have anything else, folks, please just type that into the Q&A or the chat and we will get to it. Jen, maybe just while we're waiting here, could you provide an update on redeployment and if there's been any changes or developments in that since our last chat 3 weeks ago?
Sure. There was a great article in Collingwood Today, I think, about the redeployment program, and so check it out. It was a really positive article about a staff's experience working as a redeployed person supporting long-term care. So we still have the core staff that were originally trained from the Economic Development Department actively working in the 3 homes. In the meantime, we've continued to train other county staff to kind of be available in reserve. So if we were to go into outbreak and we found our staffing levels at a critical level, then we can call on this pool of trained staff ready to come in and provide support. And there are enough of them. I believe it's well over 60 have been trained, 60. And so if we were to have outbreak in more than one home, we have staff that we could divide up and assign to one location so that we don't have the people traveling between homes.
Very good. Okay, I'm seeing some questions coming through here now. That's great. Are there any needs for staff or residents that we might be able to help source or donate to help? So what about donations, Jen? Is there any need for that right now?
So that's a really good question too. The staff are thoroughly enjoying the donations that are coming in around, like gift packages of crackers and cheese and goodies and those kinds of things. There's a program that Rob might have to help me remember, that is a local community program.
Fueling the Frontline.
Yes, thank you. So that's, if you Google Fueling the Frontline, you'll find the information, and they're a team of community members who are supporting small business restaurants as well as fueling the front line. So there's those types of things. If we are still putting a call out for gowns, and I believe that there's also a campaign, a program that, if it hasn't been released, it will be released around sewing gowns and what the patterns and criteria are for that. So the support of letters and kind gestures are really supporting the staff. If there is something else that I'm missing, I'll make sure that it gets sent out in an update.
Okay, thank you. I will just add, because we did have some situations, we are required through public health guidelines, we can only accept food from licensed and inspected kitchens, so from restaurants. So unfortunately, we do have to turn away donations of muffins and butter tarts and things like that that are brought to the home. And that is very, very painful for us to do, because we know that there's nothing more Grey County than an apple pie or a butter tart. But unfortunately, those are the rules that we have to follow. Going back, okay, so regarding essential visitors, does this have to be a physical health, or could it also be emotional or mental health issues?
Okay, well, thank you for bringing that forward. Right now, the criteria is around physical health. Having said that, we are doing work to come up with a framework that would support the mental well-being as well for residents. And we recognize that depression, dementia, loneliness, that those are really important parts of the overall well-being of all of us. And so we're working on it. Be patient, and we're working to figure out how we can fit that in as well.
Thank you. So there's a question here. How do we find out about what is happening in other long-term care homes in Grey Bruce, for instance, Meaford or Town of the Blue Mountains? Unfortunately, we can't directly give you updates. I think you would be best to contact the home. Jen, do you have anything else to add from the working group that you're a part of?
Yeah, so I do agree. It's a good idea to check out their website. A lot of the homes have updates happening on their websites, or contact the home. I can let you know that the 19 homes, long-term care homes in Grey Bruce, we meet weekly. We meet by video conference, just like this, and we meet with public health. We meet with our hospital and home care partners, and we work together to make sure that we're aligned and that we're not missing something, and that we're working together. So so that work is happening, and then I do recommend you just contact the home.
Thank you. What about haircuts? Are any haircuts happening right now?
Nope. For none of us. No hair, I'm afraid. I hope that we move into a new phase for that soon.
Yes, for sure. We want to see some of those things lifted outside of the home as well, as you can see from my much shorter haircut than I normally get here. Thank you for the kind comments, everyone that I'm seeing in the chat here. We like doing these calls and keeping you updated. We're certainly happy to keep them going. How are you social distancing the residents themselves? Are you doing meal and tray service to individual rooms?
So there's a variety of strategies, from home to home, and it's very much dependent on the layout of each building. So for example, at Rockwood Terrace, for some time, they have been doing room service, which is, they're very much more appreciated words for in-room meals. So they're doing room service instead of tray service. And at Lee Manor, there is a combination. So dining rooms, there's fewer people in the dining rooms. Some people are having room service. Some are in the dining room physically distanced from each other. At Grey Gables, the dining rooms are a little bit bigger, and so they've added some tables but spread them apart, having roommates sitting together at the tables, only 2 people at a table. So it's a variety of different things. And then the same applies for programs. So there's hallway bingo happening. I've been reading about sing-alongs that are happening in the halls. Check out the newsletters. The newsletters just came out today. And if you need a little bit of sunshine and a chance to be reassured that there is still lots of vibrant life happening in the homes, the newsletter is the place to go.
Great. I did see a question about the website for Fueling the Front Line. So I have posted that down on the chat window. If you open up the chat, you can see that there. It is through a GoFundMe page. So it's not affiliated with the county directly, and it will support healthcare workers across the Grey County, Grey Bruce area.
The other one I heard about, and I don't know if we should just be shamelessly advertising for other folks, but the Own Sound Girl Guides have a website, and I think it's called Cookie Thanks. And it's a place that you can go to order cookies, Girl Guide cookies, and they've listed all the long-term care homes in Grey Bruce, the hospitals, all sorts of different organizations, and your cookies will be delivered wherever you choose. So that's kind of a unique and innovative approach to Girl Guides who can't be going out and knocking on doors and selling cookies.
Everybody's got to get creative right now. Have any of the 3 homes had an increase or decrease in staffing as a result of staff being restricted to a single home?
Okay, so there has been a decrease in overall number of staff, of maybe original staff. Having said that, all 3 homes have increased the staffing hours. So there's actually more staffing hours happening per day in each of the homes in most of the departments, not just in nursing. And then we're actively recruiting emergency support workers. and it's a temporary position to provide support. It's not a PSW, but it's somebody who has some interest and skill in working with people, and we will provide the training, and they will come on board and help support the nursing teams, and well, support all of the teams actually, helping with things like making beds, ordering residents, assisting with lifts and transfers. So we provide training for all of those things.
Great. Can you describe in more detail what the plan for swabbing will be in the homes for the week of May 11th? Jen, do you have that information yet?
So we don't have the details. We did hear some experiences from the other homes in the county that have had their swabs done. That was something that was discussed on this week's weekly group call. So we know there was lessons learned, and they are applying those to the homes that are coming up. There's more homes booked this coming week, so we will be in basically the third week of the public health doing it. What I do know is it's a team that comes into the home supported by hospital staff, home and community care staff, and public health, and it's well arranged ahead of time. There's consents, there's labels, everything, checklists are all organized ahead of time, and then they come in. It's well set up, and everybody gets swabbed, and off they go, and then we wait for the results.
Okay. A quick follow-up to the last question there about staffing. Why has there been a decrease in the original staffing? So I'm just wondering, Jen, is that related to people maybe choosing another home where they were employed?
Yep.
Okay.
Yeah. So there were some staff who worked in more than one location, and they had the opportunity to make a choice. And many staff chose to stay in our homes, and some staff chose to go to another home, and that's okay. And that's just why the number is a little bit lower.
Okay, thanks. I mean that's important. Obviously, we need to make sure our people are taken care of, but we certainly don't want other homes and the residents there being disadvantaged either. So that's good. Thanks for the explanation. How is sharing a bathroom with another resident working?
Okay, so right now, if no one has symptoms, life is kind of carrying on as it normally was, with the exception of increased cleaning of touch points and that space. So there will be cleaning happening if we can, so we endeavor to be cleaning between each resident going in and out. If there's a concern, if someone has even one symptom, of which the list of symptoms is very, very long, and it's everything from typical symptoms like a sore throat or a cough or a fever to not at all typical symptoms like nausea, vomiting, being extra fatigued, those kinds of things. So if anybody has even one symptom, then we implement the isolation strategy. And if someone was sharing a bathroom, we would work out providing a commode to be able to have to eliminate the need to share bathroom. If your person fits in that category where they're having a symptom, you would know. We would contact the power of attorney and discuss what's going on and what the plans are.
Thank you. So now that we're talking about symptoms, our next question is about an actual, if there was a COVID case, do you see a benefit in sending the first COVID case resident to a hospital for isolation rather than isolating in the long-term care home where there may be more risk of infection with other seniors?
Right. So that is something that was shared as an idea earlier in the week, and so I did do some digging into that and follow up. Right now, that isn't an option for long-term care homes to transfer a resident to the hospital. The The support is, and the direction is to isolate, separate, test, and move right into full outbreak protocol. So we already are distancing people and have a lot of strategies in place to minimize the chance for contact and spread. So at this point, our option is we contact public health right away, and we immediately implement the isolation and outbreak protocols.
And are these directions, Jen, these aren't ours, we're getting these from the Ministry of Long-Term Care?
That's right. So the what to do in an outbreak is provided by the province. So I need to double check to see whether it's from the Chief Medical Officer for the province or whether it's Ontario Health. So we get directives from both. They're similar, they're the same, but under different titles. But those directives of what to do in an outbreak comes from the province.
Thank you very much. So just going through, if you have any more questions, please type them in. We have one here. They just want to say thank you for everything that we're doing. And an important question that I wondered about myself is, are residents getting snacks from the Tuck Shop?
Oh, my understanding is the Tuck Shop is active. I got a story, maybe it was last week, I heard a Color It story where a staff member bought all the residents a treat from the Tuck Shop.
Very good. That's great. I'm not seeing any more come in here. Jen, last week, I think it was last week, the way time flies, you were on a Rogers TV segment with Stephen Musil, the executive director of the Alzheimer's Society. Do you have anything that you would just add about the supports that they might be able to offer to families at this difficult time?
Sure, yeah. And I'm hopeful to pull together a resource list to circulate out to people who subscribe to the newsletters and the MailChimp updates. There's a lot of supports out there. So the Alzheimer's Society has been actively working to support not just people in the community that are caregivers, but also are looking at what can they do to support people who are not able to visit their loved ones in the long-term care. They might have talked to them every day or been into the home every day or every week, and that's really tough. So they have counseling services, which are virtual. They have information kits on their website, lots of different resources. The other resources that I'll mention around caregiver support is the Family Council of Ontario, and they'll attach a link when we circulate this video for the Family Council of Ontario and the Ontario Association of Resident Councils. They partner a lot, but they provide really readable explanations and updates of what's going on, and I subscribe to their updates, and often I will review their update so that I can get my brain wrapped around how do we communicate this newest directive, what are the questions that people are asking, what's important to share and to communicate. So we'll include those resources. And the other one, we're a member of Advantage Ontario, which is our association for long-term care homes, municipal, not-for-profit, and charitable long-term care homes. And it has an excellent public website. And then we also have the luxury and the benefit of a membership with the association. So we have a member website that we can access and share resources, look for information policies. And they've been doing daily webinars that I participate in and watch to keep up to date with what's happening each day. Things are slowing down because they're moving their webinars next week to just Monday, Wednesday, Friday. So it's a good sign that we're getting a bit into our rhythm, and then hopefully start the process of phasing out of these really strict strategies.
Very good. So we will watch for that list of resources coming out shortly from the county. A couple more questions here. So transport to hospital. So why is no transport to hospital an option?
So the directives, I believe it has to do with hospital capacity in anticipating a potential surge in the community. And so it's a balance between ensuring that the hospital has capacity for people living in the community and the strategies that are required for isolating and looking after people with outbreaks. We are prepared to do that in long-term care and have been doing outbreak strategies and outbreak protocols for years related to influenza, enteric stomach bug outbreaks. So I believe, and so that's my editorial version of why the province has made that decision, and that it's a balancing act to make sure that there's capacity in hospitals for people living in the community.
Okay. For residents in our homes that have the cognitive ability, do they know about COVID-19 and what's happening and why we're taking these precautions that we are?
They do. And the messages that I've received from the teams is that there's lots of conversation about what's going on. The residents are very grateful. They show they say they're thankful for the strategies that are in place. They know it's hard, but they appreciate the work. They so appreciate the staff, and they always have, and they're expressing that regularly now as well. The Ontario Association of Residents Council also provides a check sheet and a communication toolbox for talking to residents about COVID-19. And so that tool is available for us to make sure that we're keeping the residents up to date on what's going on.
Thank you. Martina has another follow-up regarding hospitals and transportation. Martina, I think you might be better to reach out to either the Ministry of Long-Term Care or possibly Public Health with those questions. It's pretty hard for us to comment on rationale on the policies. So maybe see if you can find some contact information there, or email communications@grey.ca, and I will see if I can help you get connected with the right people. How will we notify family members when they can visit their partners?
Well, it'll be a super exciting day when the restrictions are phasing out. So we'll either do something like this, along with an email out. I don't know. I need to think about what the best way to communicate something like that. My guess is we will have notice, and it'll be not tomorrow, but this is happening and we're planning it for this day and this is what it's going to look like. And it's not going to be just an opening of the doors and people coming in. It's going to have to be controlled and probably scheduled. So I'll keep you posted.
For sure, and we will make sure that people know about that through our newsletters and our direct contacts and everything, because we know everyone is eager to see that happen once it is safe to do so. I'm not seeing any other questions here at this time, Jen. Is there anything that you wanted to add maybe before we wrap this up for the night?
I'm just trying to think if there was anything else on the list. I'm impressed that my family has kept relatively quiet while we did this call. So I keep having a child running out about just off screen that you can't see them. No, I think that I'm glad that you brought up the partnerships, and I'll mention it in my closing, that the partnerships that are happening across the sector, organization to organization, are amazing. I guess one thing I can share is that the hospitals are preparing rapid response teams to be able to come into a long-term care home or a retirement home or a group home if their staffing level becomes in a critical shortage. And so this week, I and one of the director of care from one of the homes were invited to a teleconference where 60 hospital staff had volunteered to come to a session to learn about long-term care. What might they be doing if they come in as a response team? What's a day in the life of a long-term care home? They had lots of really great questions. And it was exciting to be a part of a discussion that's bringing our hospital partners into the world of long-term care. And the anecdotal story that I heard from that hospital was that 200 people volunteered to be redeployed if needed to help in long-term care. So the help is out there if we need it. Right now we're good, and the homes across Grey Bruce are good. But it's good to know that there is help just a call away if we need it. And those people volunteered. They weren't voluntold. They put their hand up and said, I want to help out. I want to help my colleagues, and I want to look after the residents.
That's terrific. Thank you for that, Jen. We do have a couple of quick ones here. I think you touched on this. So admitting new residents, do I have this right that we are still admitting new residents and they are being tested for COVID-19 before they're admitted into the home, and then they're in isolation, correct?
That's correct. Yeah, so we're admitting just from the community, not from the hospital, and they are tested. They have to have a negative test before they come, and then they are isolated for 14 days.
Is there any discussion in the groups, the long-term care group, will there be any long-term changes because of COVID-19? That's something I've seen chatter on social media and in the news is this going to change long-term care for the long term?
I anticipate that it will. I think that there hasn't been a lot of active talk about what those changes might be. We're still very much in the phase of keeping it out of our buildings and being prepared in case it comes into the home. But I anticipate that there will be changes, and I have a notebook at the side of my desk for keeping notes of the things that are amazing that have happened in a really short time that are really positive, and we don't want to lose track of those things, like the Virtual Connect program, the Color It Connect program. We don't want to lose that. If someone lives in California and they want to chat with their loved one, we have this system set up already. So I do anticipate that there will be changes. Hopefully, I anticipate they'll all be for the better, and the goal will be that they'll improve the life of residents that are living in long-term care.
Great. I see Kelly has a message in the chat. If you're looking to see someone who is seriously ill, I think you're probably best to contact the home directly, right, Jen?
Yeah, talk to the nursing staff.
Excellent. Yeah, so you can find the phone numbers for the home. If you don't have it, go to www.grey.ca. And if you go under the residence area of our website and long-term care, you'll be able to find the information for your home there. So someone here is asking, anonymous, so that group of volunteers and staff, are they the first option before the armed forces would be called in? Of hospital volunteers and staff.
Yes, and I think the armed forces are trained medics as well, but I haven't spent much research on the armed forces group and what that looks like. So yes, the first step would be managing on our own with our own staff and our own team members, and then if for some reason that becomes a critical shortage, then we would move to the rapid response team from our hospital. So it's hospital and home and community care service providers. So it's really a partnership and a team effort. And the idea is that those folks would come in for a short period of time, up to 7 days, to help us get things under control and back on our feet, so to speak. And then we would be able to then carry on our own. But yes, that would be the first step. And I think we have, we're lucky in rural Ontario and in Grey Bruce that we have these hundreds of people who have put their hand up to say they would do that. And the hospitals and partners are ready to get them into the homes if we need them.
Thank you. We do have a comment here about workers' abilities to answer phones, and we do ask for some patience and people to understand that all our staff in the home are doing everything they were doing before COVID-19, plus all of these additional precautions. So we are doing what we can to man those phones, and I'm sure that we have protocol for response times and things, Jen.
So off the top of my head, I don't know. We try to get to we want to be as responsive as we can, as quickly as we can. So if it's something that's been kind of ongoing, just reach out to me, and I can help get you connected to the right person. Email is another option as well. So if we're not getting to you, keep trying, and I'm happy to take an email or a phone call and get you connected where you need the information and where you need to get connected.
Okay, thank you very much. So I think that's pretty much going to do it for tonight, everyone. Thank you very much for joining us again. Seeing so many attendees here, I think that we must be finding these useful. So I think we'll continue on with these, Jen, as we have more updates and things to give out. We're also going to try to get out weekly newsletters as best we can, just with updates to make sure if we're not having these calls that we're still flowing information to you about changes and updates in the home. So thank you. As usual, when this call is done, we will make a recording available online, and I will send a link out to that. And if you had any other family members that were unable to listen and you think that they would benefit from this, please do share it with them. So thank you very much, everyone, and have a great weekend.
Good. And I do have something more to say, if that's okay.
Yeah.
So you may read this in the newsletter, but I just wanted to wrap up with this. So I know that these times are difficult. They're lonely and unknown and full of worry. And in times like this, we need to look away from fear and look towards courage and trust. And there are glimmers of hope and light. And I've shared some of them through the call. But the teams in the homes are working hard to sustain our strategies, and they are fueled by the continuous outpouring of love and support from you, from the residents, and from our communities. The health sector is working together in ways that I've only dreamed of, with partnerships and innovation and collaboration, all in the spirit of helping each other and ultimately supporting the residents, patients, and clients. And I like to close the same way each call, and I want with extending my gratitude to the residents for being understanding and supportive and staying positive, to you, the families and friends, for your words of encouragement and staying away when I know how hard that is, to the team members in the home for your courage and your commitment. Thank you again for being here tonight. Stay strong and stay well.
Thanks, everyone.